Hi, my name is Tori. I'm with the Child Life Department here. I'm kind of like a teacher in the hospital. My job is just to make sure you understand everything that's happening here today. What's your name?
Pete.
Hi, Pete. How old are you?
I'm 8.
That's so you're in school right now.
Mm-hmm.
Yeah. What brings you here today?
I've been getting really dizzy, and the doctors think there's something wrong with my heart, so they're going in today to see.
I see. So what you're telling me is that the doctors need to check out what's going on in your heart. I know you talked to my friend Rose earlier, who showed you some pictures of the room that you're going to see. What questions can I answer for you?
Well, I'm really scared of the doctors cutting open my chest.
Well, Pete, that is, the doctors are actually not going to do that today. I have a doll that I can show you how they're going to look at your heart that we can play with together if you'd like.
Okay.
Great. So this is my doll. Do you know what the blue lines in your body are called?
Veins, right?
That's right. They are called veins. And those lines go all over your body to transport blood. And in order to look in your heart today, they're actually going to use one of those to put a camera up through. So this straw is like a very, very big vein. We use one that comes from your groin. Do you know where your groin is?
Mm-mm.
It is where the top of your leg meets your hip. So what they're going to do while you're asleep, first they're going to put the mask on you and put you off into your special sleep. So you'll be asleep for the whole time. Then what the doctor's going to do is take a little straw and put it into your vein to make it stay open for the whole procedure. Next, what they're going to do is take their long camera. It's long and flexy, kind of like a pipe cleaner. Then they're going to thread it up through the straw, and it's going to go all the way through your vein to see your heart. And see here, that's what the doctor will use, either a camera so they can take pictures and see what's going on. They inject some special dye through the IV that you'll have in your arm to make all the passages in your heart light up. And that way they can see how the blood is flowing, so they can try and figure out what's going on. Afterwards, they take the straw and the catheter out, and they're going to give you a big Band-Aid on the spot. Now this Band-Aid is going to be very tight, and you're going to have to lay flat for about 6 hours, but we can put on some movies for you or play some video games to keep you occupied while you lay flat. You're not going to be able to do a lot of running around and playing for the next couple days while it heals, but afterwards you'll heal and be perfectly back to normal in about a week or so. Would you like to try cardiac cathing this doll?
Okay.
Here you go. Show me how you would do it. Great job. And as you can see, all of the stuff comes out, and the only cut you're going to have is right at that at your groin where your leg meets your hip. Do you have any other questions?
No, thanks. I feel a lot better now.
Great. The doctor will be back in a little bit to talk to you and Mom, and then when you go back to the special room, maybe I can come back with you and show you some videos to keep your mind occupied before we go to sleep.
Okay.
Great.